Hi, I'm Claire with Spruce PT, and this is how to use a dilator vaginally. So this is a set of vaginal dilators to be used vaginally. You can also use them rectally because, and this is the size 3 of this whole set, this base here, or a flared base, is what is required in order to put something in rectally safely. And so you could use these rectally, but these are vaginal dilators. For more education on how to use any product internally rectally, check out one of my other videos. So to use this vaginally, and I'm just going to use this size for show, you would use any of the sizes that you have been prescribed from your provider. And for more information on how to choose the size of your dilator more appropriately, you can also see one of my other videos on that. So what you would do is, first of all, you want to start in a really good position where your core is not turned on. And so what you'll do is you can either lay down on a couch like this with your knees up, so then you can access the area without having your core on. You can also lay down on the ground with your feet up on the couch or something like this, or in a bed with pillows built up. So you can also be in this sort of position. So you can be relaxed, your most relaxed self, and have your core off and still use the vaginal dilator. So from there, what you'll do is you'll put a lot of water-based lubricant. It's important that it's water-based so that you don't affect the silicone. And so what you'll do is you'll insert the dilator with your pressure down at the bottom. So what you want to think of as the opening is a clock. You've got 12 at the top, 6 at the bottom, 3 and 9 on either side. It doesn't matter which side is 3 and which side is 9, whatever makes more sense to you in your brain. But you'll insert like this. And sometimes for some people, this is going to be enough, and where you just kind of insert it slowly, and then you can leave it and breathe and relax and just kind of wait for the muscle to kind of accommodate the structure. And all of this should take no more than 10 minutes, including the setup and the takedown of all of this and the cleaning, etc. You don't want to cause yourself pain with these. It's okay if they're a little bit uncomfortable, but you really don't want them to be painful, because we don't want to keep learning that something that you insert vaginally would be painful. And so that's not great for your brain and not great for our progress in PT. So pain, you're done for the day, but a little bit of uncomfortableness is totally fine. And I know that that can be a really fine line, but that's up for you to decide. And so if you can insert the dilator that you're using all the way, you can also kind of go up the sides to 3 and 9 slowly. You go a lot more slowly than I'm going in this video. I'm just trying to get the point across. You can also slide it. So in the twisting part, you would be going to each of the numbers by twisting here. And you can see this flower on the bottom is kind of rotating. Or you can kind of slide along the bottom. Either way, you should be getting some good release through the base here. I usually have my patients working on 2 different sizes at once. And so one size you could be using to kind of get a little bit more mobility, and then maybe a larger size you insert and kind of breathe and relax and just try to get the area to accommodate. And you want to also make sure that you're cleaning these well in between each session.